and we are going to talk about the upcoming 2024 NPTE updates. And this is a very important class based on historical data. I will talk about some of the things which are important for you as potential physical therapists and physical therapy assistants. We'll also talk a little bit about how to prepare for the exam. We have a lesson plan or an outline of the lecture coming up and some practice questions so that your time is well spent with us for taking this exam in January. So before I do anything, I have few disclaimers, and they're very, very important to listen. We are following strict FSBPT APTA guidelines. Don't think that I know something which you don't know. We're going to just share the information which is publicly available or available at DPT programs across the nation. I also will recommend you not to talk too much about or not, at all about any previous NPT experiences. And this class is being recorded from start till the end. If you are new to this program, my name is Bhupinder Singh. I am the lead instructor and founder of Final Frontier. And I decided not to share too much detail about me today because this class is not about you knowing me. This is about the PT community knowing what is coming up in terms of changes. So before I start talking too much, how is everyone doing? Good, great, nervous, new exam coming up. So let me tell you a little bit of history. And I know I have gray hair and some of you are probably much younger than me. So what happens is FSBPT, and I'm going to type this for all of you. FSBPT is the Federation for State Boards of Physical Therapy. So they are the people who are in charge of a license exam, and a lot of healthcare professions have a similar organization. So we do know that FSBPT is a 501c3 nonprofit, which means they are responsible or answerable to the public of the United States on some of the things they do. I am also a board president of another nonprofit. Some of you know Facts for PTs is one of our nonprofits. David is on the board. We have some team members here who are on the board list of that nonprofit. But FSBPT every year has to listen to what are some of the concerns and good things about this profession. So what happens in that process, and I think most of you know it, but just in case, so every 4 years, they come together and say, we are going to give you a blueprint of what is going to come on the exam. So if any one of you is concerned about, okay, what will come on my exam, you can literally go to your web browser or Google or wherever you're searching and say FSBPT blueprint or content outline, and you will get a PDF of what is available or what are the expected topics for the exam, okay? So that's why I said this class is going to be a lot of information sharing on what is happening for the future of this exam. So 2018 to 2022, we had an exam format, and then COVID happened, so that exam format was extended to 2023. So anyone who took the exam, both PT and PTA, they had a blueprint of questions and content which was created in before 2018, and it was used for 5 years. So every 4 to 5 years, they evaluate what is being tested, what is being used in the clinic, what are some of the new skills which have come up in the PT practice, and then the board, using a task force, conducts a lot of review, collect a lot of data, and they launch a new blueprint. So today is the historical day because they have included or launched the new blueprint for 2024, and this would probably go for about 4 to 5 years. So anyone taking the exam in January of next year or April or July or next year in 2025 is going to have to experience this new format of the exam. And I want a little bit, I didn't make a poll on this. How many of you are aware of this information? You can say yes or no. How many of you are aware that this happens, that every 5 years, 4 years, there's an exam change, and then we are now in the new cycle. So I assume most of you are, because you got emails from me, you got emails from FSBPT, but a lot of times email gets lost in the chain, right? We can say I send a newsletter, but maybe I did not send to everyone, or I send it to someone and it goes to spam. So it's very important for us. That's why I'm doing this class, that we are now in the 2024 cohort, and everything which is going to be covered is going to be based on this new format. Okay, now there are a lot of questions, right? So we're going to do content, but this class is about 1 hour, 15 minutes with a lot of time for questions at the end. So the first question is, should I be worried? And I will answer all of them today. And my answer is no, please don't worry, because from an instructor point of view, I've been in the PD field for almost 20 years now, and I'm currently a program director or the department chair of a big DPT program. I have been a professor teaching classes. I've done research in the PT programs. I've seen it all, if I dare to say that I've seen the upward growth of PT. So if you ask me as an instructor, I am very happy that this is happening. We have been asking it for a long, long time. We want the exams to be more case-based scenarios. We want the exams to have more clinics data on it. We want exams to have pictures on it so that you don't have to keep guessing what happened to the patient. We wanted the exams to have videos on it. So as a professional representing the profession of physical therapy, I am very excited about it. But I also understand that students, which is you at this point, are nervous of the unknown, right? It's human nature. Whenever something changes, there's some anxiety. Think about the elections. Who's going to be the next president? So people do get anxious, they do get nervous, and that is okay. But I don't want that nervous anxiety of the unknown to have a fear in you that I don't know. Is this exam going to be very difficult? Should I pass? What's going to happen? So there's so many questions which need to be answered here today. So I would encourage you, because you probably saw the slides beforehand, I would encourage you to look at the list of questions we put together based on your feedback and some of the things we think are important, and also add what your additional questions are. And in the duration of the next 1 hour, I will answer those questions for you. And then we will have this slide come up again at the end of the class, and we will talk about any of the concerns which are not addressed. Okay. Sounds like a plan, I think. And this is an open class. You do not have to be an NPTE Final Frontier student or enrolled or a paid member of this. This is a community call saying, we got it. We know that the exam is changing. It changes every few years. And I want you to be aware. There's a little bit of personal bias here. I took my exam way, way back, but I have gone through the cycles of 2013 to 2017. I've gone through the cycle of 2009, 2008 to 2012. So I've gone through some of these cycles, and I really wished when I was a student that I knew that there were changes coming, because I took the exam right at the change cusp, and I was anxious as a student. So hopefully you are not anxious after listening to this class. Okay. Any questions you want to add to this, please let us know. I'm joined by some really awesome team members and co-hosts. You will see a great lineup in the chat. We have David, who introduced you. We have Amanda, Priyam, Pamela, Megan, Rekha, Siddhi, and they are all exceptional instructors. And the best part for me is they are all alumni of NPTE Final Frontier, which means they did the same exact thing you're doing today. Someone like Priyam probably attended this class with me in 2017 when the new changes were coming. Some of the newer team members probably didn't have to worry about it because they knew they're in the middle of the cycle and nothing was going to change much. And someone like Megan Duncan is here. They were right in the middle when they were like, oh, COVID happened, so we're going to extend this. And they probably experienced some similar emotions as you did. Okay, I don't want to keep you here for 1 hour, I could have made a YouTube video and you could have heard the changes. But I personally believe that doing this together will help us feel more comfortable. So we are going to cover some content. It's not going to be a lot, but I think it'll be helpful for everyone to get a feel of what it will look like in the next few years. Okay, so here's a new format, and I will talk a lot about history in the first few minutes because that will help people. I see a lot of names already, which I recognize, who have taken the NPTE in July or October. So this is very important for you. If you're a new DPT grad, you're in good hands. Just know what's on your course syllabi, you'll be fine. But the change is going to be a little bit hard for some people. So I am going to talk to you about PT first. So the physical therapy exam for license used to be 5 hours long, and it used to have 5 sections, but it used to have 250 questions in the past. Okay, so now you're like, wait, they decreased the number of questions? Usually things increase, right? You're like, oh, we need to test more. So what they did is they tried to, I shouldn't say they, everyone in the community, PT community, wanted more case-based scenarios. So now we have 225 questions, but we would have about up to 40 scenario-based questions. Some of you are like, wait, we do scenario-based questions, right? If I say the person got ACL injury, what special test will I do? That's a scenario. But now we're going to talk about how to build on this scenario. If someone had knee pain, what was the reason? Okay, which special test would you do? Which exercise would you give? So the patient will stay the same, and we'll have to treat them in different clinical scenarios. That's a big difference. So the number of questions is actually decreasing. Same thing is happening with the PTA exam. They used to have 200 questions and in 4 hours, and they are also going down to 180. Okay, so repeat again. The new format is here. It's live. You're going to take the exam in January, and when you take the exam, you're going to have 225 questions. And let's see, who's good with math? It used to be 50 questions per section in the old set. And how many questions do I have now per section? Look at you, smart. 45, right? So 45 questions, 5 sections, 225 questions. And in the past, we used to say there will be 200 questions which will be graded, right? So they will have 250 questions, they will not use 50, and they will give you the score out of 200. But now they decrease the number of questions. Should they decrease the number of total answers you need to get correct? Yeah. So the passing score, the new passing score is going to be out of 180. And I really wanted everyone to listen to it and think through it with me, because that is going to be a change. Okay, how does everyone feel about this? You're the future of the profession. You are going to take this exam. You're going to be the first. It's exciting. It's like you're going to be the first set of students who graduated with a PT degree, and you're going to, yeah, you're going to take this exam. How do you feel about it? How do you feel? Is it a good change? I'm not doing any polls today. I don't want you to have to worry about too much logistics. This is more of a casual feel. I personally am, my wife calls me, I'm very lazy, right? Because I find ways to get things done sooner and faster, efficiently, because I don't want to do the hard work sometimes. So I'm very excited. If I was a student, I'm like, okay, great. I have to do 225 questions instead of 250 with the same amount of time. That's a good deal to me. So we'll talk about A little bit more about PT, PTA numbers. I'm not going to confuse you too much. I will have a couple of slides telling you how do we predict how many questions do you need to get correct. Our initial estimates are that anywhere between 122 to 128 is a good score, but I will refine it for you as we go along in this cohort. Okay, so repeat one more time for people who don't like math like I do. So overall, if you're like, tell me the gist of this is too much information. What is going to happen? The thing that's going to happen is we're going to decrease the number of questions for both PT and PTA exam. We're going to try to shift from the traditional one question per one patient to a case-based scenario format. There'll be more videos, more pictures, and you will do awesome. That's all you need to know. Okay, I think everyone is like, tell us a little bit more. This is good information, but I need more. I need the scores. I need what they threw out, what they added. So here are a couple of slides coming up for you, and they are going to tell you what kind of questions have been added. What are scenario-based questions? What is this all about? So scenario-based questions are the new additions, but descriptive questions will continue to be asked. We'll have picture questions. We're expecting a little bit more. So again, I want to go back to history because those people who took the exam in October or July or previously, we used to say picture questions will be on special tests, wound care. I'm just giving some examples, EKG and MRIs. So this used to be the traditional way of saying, what pictures should I know? Show me a pressure ulcer, show me a special test in musculoskeletal, show me an AV block, show me a spondylolisthesis, right? Now, the push is towards having pictures which describe ongoing interventions. Again, that's very exciting for me because I used to be so worried sometimes as a student or as an instructor of NPTE coaching classes, where I was like, okay, so they're showing me this image, but it's just a still image. What happened after? What happened before? It's like watching a poster of a movie and not going to be able to watch the trailer, right? Correct. So you just see it. Some of you know Priyam, right? She's one of our co-hosts here. You see Priyam from the outside, her picture. She's like, I'm a licensed physical therapist. I'm OCS. I got a perfect score almost on the NPTE 6 years back. I love teaching. I have done all the good things, right? If you look at her picture, you'll be like, yeah, this is the most studious person you'll ever meet. And then you meet her in personal life and you take her to a bar. You're like, you drank all of that? You finished all. So that's what we need to worry about, right? So that's going to be the change. So when you see a video, that helps me know what happened and I can plan my treatment better. And then I know a lot of nervousness where they're like, wait, case-based scenarios, they're making this to suffer. Yes, they want you to suffer, obviously. It's a business, right? More people fail, more money is made, but we don't want to go there. We want to keep our focus on exam is coming and what is going to be on it in terms of scenario-based questions. So again, I could have created a YouTube clip and called it done as some of the other NPTE prep programs did when I was a student, but times have changed. We have a lot of compassion and empathy for the profession from the future incoming classes, and I want to mimic that relationship. So I'm going to go through this with you together. So we're going to talk about how many questions in which section are going to be tested. So this is, again, public information. You can go to FSBPT content outline, and these are now updated. They will show up. David is awesome in looking up these things. He was scrambling for the calculator when I asked how many questions per section, but He will share the links with you in the chat. In case you're listening to the recording, we will also have it on your course page. And it says, number of items, musculoskeleton historically used to have 60 up to 60 questions. So as you can see, musculoskeleton has gone down a little bit. And I'm not going to give you the exact numbers for everyone, but musculoskeleton was 60, used to be 60 questions, and now it is. No, I'm not going to ask you to read a table on a Saturday morning. We're just going to read across this line, and it's going to be about 44 to 54 questions on musculoskeleton. So you can go through these lines together. You can say, okay, I got it. I see what you mean. We're going to be looking at each system: cardiovascular, musculoskeleton, neuro, integumentary, metabolic, GIT, genitourinary, lymphatics, and system interactions. And these are their subcategory: physical therapy exam, differential diagnosis, intervention, and this is the total number of questions per section. And the good news is none of the course syllabi changed. And repeat again, the overall course syllabi, which means they did not take out lymphatics. Everything is the same, but the number of questions are a little bit less, and they're going to be tested a little bit more clinically. Okay, I see some of you asking, where can I find this? Where's this information? Again, this is public information. FSBPT, like us, is a public organization. They are not, when you hear the word FSBPT, you think like FBI of the healthcare part, or you think like it's a federal, because it says Federation of, but it's not. It's a nonprofit. So everything is available for everyone. So here is the content outline. If you're listening to it later, feel free to see it. The content outline is going to be available as a link to anyone in the chat also. All right. Also, I want to share that these are very small changes as compared to some of the changes which are happening in the PT world. I think some of you are aware, genomics is coming back with a really strong presence in the PT future. So mapping and genes and genetics, but it will take about 10 years for them to show up on the NPTE. So we follow the clinic leads, and the NPTE follows the pattern. Okay. For those who are PTA friends, we also enjoy having you in these classes. So you are welcome to this profession. There is your update. Most of you should know we do have a PTA prep program, and it's taught together for a few classes, and they're separate classes. Megan Duncan is leading that. She is a PTA who also has a DPT. And then we have Ashley here, and we have a couple of other people. Utsavi, they're all helping you with the PTA team. So you are counted in this change, which makes me very happy. I've been blessed to learn a lot from the PTAs I've worked with over the years. So again, the number of questions has decreased, and we are gone to about 140 questions instead of 180. Okay. If someone is confused why I'm smiling and happy about it, is anyone worried why I'm like, this is a dream come true. I've been asking for this for a long time. I am in too many circles of the physical therapy world. I'm a fellow of the leadership cohort, which means APTA has less than 200 people who are identified as fellows in leadership. These are the people who are program directors and deans. And this is so exciting for me that they finally are like, okay, yeah, let's do that. Quality or quantity. I need less questions and more case scenarios. So I'm very excited. The other reason I'm very excited, and this is more business mind. So we have NPTE Final Frontier, which is our US candidates, but we also have PCE Final Frontier, which is Canada, or Canadian competency exam. And we also have APC Final Frontier, which is Australian Physical Therapy Competency Exam. And they've been using this for years. It's been years they've been using it. If you go to my PCE, I don't teach it, obviously, I'm not licensed there, but I can found it and I can create content for them and I can help them learn the teaching aspect. So we are going to expect that our expertise in creating clinical scenarios is actually going to help our students here also. So this is a win-win for me, and I always want you to win this with us. It's not just a me or I, it's a community which we need to fill. Okay, so questions on any changes, content outline, PT versus PTA, how many questions are increasing, summary. 200 questions used to come on the exam as a final score. Now it will be 180 for PTs. It was used to be 150. It is going to be 140 for the PTAs. And this is the breakdown for each of the question changes. Can I test more math? No. Okay, I'll stop. David said no more math. Okay, scenario-based questions are here. Introduction to the first scenario-based question. This is also very exciting because the news was released last year that NPTE was going to change, because obviously you find out from the newsletters and the professional circles. So we knew about it, and then the team got excited. So for every time for the last 1 year, wherever we have gone, we have been recording videos. You will see a lot of them. You will see Priyam and Megan, even baby Bo, who's Megan's son, almost 2 years now. He is in all the pediatrics videos. We have Brunda, who's our neuro instructor, in all of our spinal cord injury, rehab, wheelchair transfers. Rahul was here. So we have so many videos now. It's like an Instagram of NPTE content, seriously. So we have all of this ready for 1 year, and we were just waiting for this official announcement. So we're in. Do you see how a case-based scenario questions on the screen? Guess how many we made, just like this, because we didn't know how many they were going to ask. We made more than 100 case scenarios. Good. Omnia, that's a good guess. So I have 100 to share, but I'm not going to bore you with them. I'm going to just go with the first one. And this is tried and tested. We have looked at FSBPT example they have given us. So everything is on it. This is the new question format. You are the first cohort to listen to it. So you are special. This is a question. Let's read it together. This is a case-based scenario question. This is an example. It's a little bit different than BigNets. I will explain that a little bit. That's our Canadian and Australian exams. So I'm in an outpatient setting. This is my office. I get a patient, female, 25 years old. Their problem is they have right knee pain. Should I ask them? They have right knee pain. They had swelling for the last, how much swelling do you have for the last how many days?
2 weeks.
She said 2 weeks. She couldn't read the slide.
2 days.
Too much drinking.
No.
She has, describe your pain.
My pain is dull and achy. And anytime I move my knee or I weight bear, the pain increases, especially after last night.
Okay. And then she feels a catching sensation. When do you feel a catching sensation?
Anytime I move my leg straight or I bend it, like there's a catching and a clicking sensation.
Okay. And she played soccer. So past history is she had a fall 2 days ago while playing soccer. And then she twisted her knee while the foot was on the ground. And no pop or any sound was heard at that time. Hey, I don't drink, and I'm not joking. I am not talking to a robot here. Priyam is actually here. She's mad at me because I was supposed to save a Final Frontier t-shirt for her, and I forgot. So she won't come to camera because she doesn't have a Final Frontier t-shirt and she didn't do her hair. She said, give me some time, I'll come. Okay, so we have a patient. That's what I want you to do. Oh, there she is. She'll come on this side in a minute too. So I want you to think about this virtually. When you see a case-based scenario on the exam, do not freak out. Do not. It's just a patient you see every day. 25-year age. They have knee pain. You read the instructions. They feel catching sensation in the knee. They live in a single-story home. They want to walk 10 minutes every day from their house to the train. And now what do you do as a PT? I know a lot of you are jumping, right? You're like, ligament, meniscus, no pop, ACL. That is exactly what we want you to do now. We want you to think. Now, let's go ahead and look at pain was, so we're going to do physical therapy examination. Let's do it together. Okay, so what's the number one way to be successful on this case-based scenario question? And my number one suggestion to you, and I'll probably repeat it 50 times in the next 1 year because we'll be teaching this in all the classes we have. It will be, you want to go in sequence. First exam, eval, differential diagnosis, and then intervention. Please do not jump from one to the other. That will cause you to have mistakes. That's my secret of getting this correct. So I got the history of the patient, 25-year-old, knee pain, history of soccer, single-story home. I got all the information I need. You all do this in your PT programs and your clinics. Now I'm going to do an exam. Pain is 6 out of 10, at best 5 out of 10, worst 8 out of 10. Seems reasonable. Most of you should see that. So painful and limited knee flexion and extension. Okay, that means that when you are, because she doesn't have a Final Frontier shirt, so we have to use the virtual model. Otherwise, we could show her knee. But here's painful and limited knee flexion and extension. They're tender to palpation on the medial joint line. Palpable swelling around the knee joint, increase in pain with deep squatting. Okay. Who feels like you're in a clinic and you're like actually treating a patient? You can say yes or no. See, that is why this change is a positive change for us, for the profession and for you. This is a positive change. We want, the whole purpose of the license exam is to create safe clinical physical therapists who can safely treat patients in the community. So if I ask you what is the nerve supply of gluteus maximus, is that testing your safety? Probably. It's most testing your memory and recall and how fast you can Google that. So I would much rather you be ready by using these case scenarios and then treat our patients. Okay. I do have so many questions still on the exam format, which is reasonable. So I'm going to repeat it again, and I will just, to avoid confusion, just talk about PT for now. The exam is going to have 225 questions. If you're taking the exam for the first time, 225 questions, there will be 45 questions per section. And yep, you're right. So 45 questions per section will be used. And then our total score is going to be, and 180 questions will be graded, and your score will be out of 180, and its scaled score will be still 600 out of 800. So hopefully that answers most of the questions. And I can say names if that's easier. Jyoti, so when I'm saying 45 questions are not graded, I didn't think we can say that. We are saying from each section, certain questions will not be graded. And most likely what would happen is you will be at question number 40, and question number 41 might be a case-based scenario, just like the ones you're looking at. And then question number 41, 42, 43 might be a case-based scenario question. And that's how they're going to change the exam. Okay. So everyone read it well. And we're going to check how many of you can remember this patient. I gave this patient Priam. We gave the name, but in your mind, you can think of any name. This patient is going to be your patient for the next few minutes. So let's go ahead and look at what kind of a scenario question would come with examination and special tests. Okay, I have the poll open for you. You need to remember what you read about your patient, and then we're going to answer question number 1. You're welcome to answer 2 and 3, but I would really want us to focus on 1 because the first time you're doing this, I would really want you to be able to read what your patient had. And these slides are available for everyone. We're not hiding anything. If you're competition, good luck. We did it for you. Use it wherever you need to save, download. I want you to have access to this information because this is very important for you passing in January. So read this question. Go for it. I will try to mimic what will happen on the NPTE. So I will stay quiet for about 1 minute. You will usually get 1 minute and a little bit over time to answer each question. And for those who have accommodations, we respect it. So you get additional time, time and a half or 2 times. And I want to have you read the question and answer on your poll. Good job, everyone. See, it seems like we're treating the patient. We're a patient, they had knee pain. You're like, okay, let me see what's happening. Come, this is my office. You will have a table, a treatment table, a plinth, whatever technologies you have in your clinic. And you're like, I think I suspect something happening here. It may be a meniscal tear, maybe an MCL, maybe ACL, maybe PCL. So what you're doing here is you are going to read this with me. So think about treating this patient. You are going to perform a special test as shown in the image to diagnose the condition. The test is positive when the PT moves the tibia in lateral rotation combined with the compression force. Which test is being performed and what is the most likely diagnosis? So they are doing an Apley's maneuver. So the patient is in prone. This is their femur. This is their tibia. This is their foot end. So I'm going to flex their knee and then rotate it with a compression force. So this is called an Apley's maneuver. A-P-L-E-Y. Apley's maneuver. And what does Apley's maneuver do? It will help diagnose meniscal injuries. That is an example of the first of the 3 questions which are based on the same scenario. Okay, I'll repeat this any times you need here. This is important. Once you get it, you'll be like, oh yeah, okay, now I get this, the sequencing here. So Apley's test, medial meniscus tear is a good answer. If you went with posterior draw test, valgus press test, Tastley's, These are really good tests, but we are looking at the picture. And I had a poll open. You're probably answering it still. You can keep answering it, but I want to tell you that A is the correct answer. And to keep our theme of sharing information, even if the information has been covered in your previous classes, probably every PD student here has done an Applees or a Thesleys or a valgus stress test, but things get lost sometimes with retention. So we will give you a rationale on the screen, and it will say question number 1A, the therapist is performing Appley maneuver to diagnose meniscal injuries, pain with tibia in external rotation, and a compression force with a compressive force is indicated for medial meniscus tear. Good. Okay, wait for the poll results because I'm going to show you one more question and we'll come back to it. I just want to run you through the whole session once. Okay, so let's say you answer the first question. You're like, okay, I did an Appley's medial meniscus tear. Got it. Read the second one and keep answering on the poll. Good job, everyone. You can answer on the poll, but I just wanted to give you a sense on what the question would look like. So it said, we'll read this together, okay? So the patient has been recommended to ambulate with partial weight-bearing status by the physician. Which of the following would be the most appropriate assistive device for weight-bearing status advised to the patient? Now, some of you are like, yeah, medial meniscus, partial weight-bearing. This person is going to walk. They are going to need some assistive device. So you could answer this question based on your knowledge about the medial meniscus. So if you're still imagining this patient, you can say, yes, medial meniscus patient, partial weight bearing, probably cannot use a cane. Okay, so cane is not a good idea yet because it's partial weight bearing. Unilateral is also not a good idea. So no auxiliary crutch unilateral, no Lofton crutch unilaterally. And I need a bilateral support and I need auxiliary crutches because it's partial weight bearing. So D is correct. Now here's the awesome part of it, at least for me. If I did not get the previous question correct, let's say I pick PCL in the previous question as a correct answer, I still have a chance to get this one correct because, why is that? Because partial weight bearing status is going to be bilateral auxiliary crutches for any condition, right? Because the unilateral crutches are not going to be appropriate. You're not going to be able to use canes because if I use a cane, I'm going to hold it. All of you have seen a cane. I can show you a cane if you need, but I can hold the cane in one hand and I hold the cane in the other hand, but at some point I'll have my one leg on the ground with weight bearing on it, and that's not allowed. Canes are not good for partial weight bearing. and we do need crutches, and we can't use one crutch. We need crutches for both sides. So the correct answer is going to be option number 4D, and a lot of you did pick it, so that's good. You're becoming experts in this. Okay, I'm just going to give you some time to absorb this, because you're like, wait, so I could have missed the first question scenario based, but I could still get this one correct. And that's benefit for me, because that decreases the stress you might experience in answering the first scenario based question, because you know that even if you get it wrong, you still have time to catch up. Okay. Any questions you have? Obviously, you have the experts here. This will fall under musculoskeleton and non-systems. We have a lot of musculoskeleton specialists. I think some of you might know, if you're part of the previous cohort, a lot of our team members are OCS, which means they're orthopedic clinical specialists. They have done 200 hours, 2,000 hours. 200 will be nothing for them. They do that in a month. They have done 2,000 hours of clinical care in musculoskeleton only, and then passed an 8-hour exam, just like the NPTE's 5 hours. They passed an 8-hour exam, which had a lot of clinical scenarios just like this. So Megan is here, Priyam is here, Rahul was here earlier, but we have Rekha, who's a recent OCS passing candidate. So we have a lot of people who are OCS certified, so they can tell you more information about this, but they also have passed the NPTE. So we want to be able to use their expertise. So, but also, this is just an introduction to the new format. When you are in class, we'll spend a lot of time on doing non-systems and crutches and canes and walkers, and we'll show you those on this camera. We will probably meet you in person in one of the boot camps and have you do it with us. So a lot of information will be covered. This is just to give you an example so that we can decrease the stress level a little bit here. We don't want to stress you too much about this new change. We just want to say the new change is actually a good change according to us. Okay, I will continue the poll for the third question. This will help us. Yeah, we can't leave this patient alone, right? We have to finish the treatment part. So question number 3 is the same patient, and I need you to help with the rehabilitation when you're managing them conservatively. No surgery here, PT work. What should we do? Okay, what were the 2 reasons I was very happy? Does anyone remember? 1, I really wanted the profession to move forward, and I think clinical scenarios are a good way for us to do it. What was the second reason I was very happy? Because I felt really prepared and experienced to handle these questions because of my background helping other country students, Canada and Australia. And what's the third reason why I'm very happy now? How many of you felt that you could answer this question in less than 1 minute? Anyone felt that? Right? Because you already know that you're patient. You're like, yeah, same girl, medial meniscus. They're asking me to treat. And I already have a picture of that patient in my head. I know what went wrong. I know the special test, which was positive. I am being asked now which exercise would be most appropriate to include in the early stages of rehab of this patient. And you're like, yay, do quadriceps sets. We need your quadriceps to be stronger. Right? And that is correct. And almost 85% of you got it. 85% of you got the Applis test. A couple of you struggled with the crutches because you picked a unilateral crutch. And then about 83% of you said, yeah, quadriceps. We need quad strengthening exercise to make sure that this patient is getting good treatment from the PT. And don't tell this to anyone. Think about it. They gave us case scenarios so that we can treat patients in the clinic better. They gave us case scenarios which are going to help us answer faster because we already know our patient. And they gave us more time. They gave us less number of questions in the same 5 hours. We should be able to pass this. Right? Uh-oh. I get in trouble with our business managers. How many of you know Derek Camilleri? If he's listening, he's listening. He was Air Force for 6 years. I'm sure he's doing a round just by fun. He's like, okay, let me go for a ride. We walk, they fly to get their morning run. I'm sure he's listening. And I'm sure from a business perspective, he's like, wait, dude, you're supposed to sell this course and you're supposed to tell people to enroll with Final Frontier. And what are you telling them is the exam is actually going to be easier to pass. Right? But that's what we need. We need a lot of PTs to pass the exam. You have patients waiting for you. I got a call from someone. So my office, I don't teach at home because I think it's a professional courtesy that if you're paying us your time and resources and money, I shouldn't be teaching when their kids are dancing around and my internet is shady and I have lighting which doesn't match what you were expected to on an online platform. So my office is called NPTE, and someone Googled it, and I got a call in the main office. It's like and they're like, we can't find a physical therapist for the next 15 days in this area. Can you please treat us? So people are looking for, they're making assumption that someone who teaches NPTE must be a licensed PT and maybe they can treat us. That's how bad the shortage is. And I'm in a pretty well-served community of patients with a lot of PT clinics, right? So it is important for you to graduate and pass as soon as possible. We really need you in the clinic. I don't know how else to say it. So I don't care if you join Final Frontier or not. I really don't. I really want you to know that the new case-based scenarios are not that hard as advertised sometimes on the business perspective. I just need you to pass it and be done. Okay. Ben, I'm sure your internet is much faster than when I was a student. So we got it. So I'm going to say the correct answer was option B. In the early stage of rehab, you do quad sets and they're safe to perform. A, C, and D are probably too early, and squats only to 45 degrees are allowed. So B is the correct answer. Okay, so 3 questions have been done. We have really put together a lot of time in working through these with you. Obviously, that makes me feel good that I know what's expected. Hopefully, that makes you feel good that you know what's expected on the exam. But I, again, want to confirm. I want to confirm this one more time. So let's take you to the actual exam day. Okay, so you're in an actual exam day. And in the actual exam, they said, question number, let's say 40, you've done 40 questions, and question number 41 shows up, or let's say 42 shows up, whichever one you want. So 42 questions shows up, and you see this case scenario. What do? You freak out, you get nervous, you mess it up, and you don't pass the exam, right? No, none of that. You relax and you're like, okay, good job. You smile at the question and say, finally, we have a case scenario. You read it calmly, you feel good about this, you spend some time visualizing your patient, and then you're like, okay, let's see. You go to question number 42. It says, what special test? And you said, aptly. Question 43, what should they do? Bilateral axillary crutches. Question number 44, what exercise should we give them? Quad sets. And question number 45, which is the last question of that section, is going to be a scenario-based question, and it might be a video question. So we have a video for you coming up. Oh, sorry. And I'm going to first launch the poll for you, and then we will play it on the bigger screen so that you have access to it. Okay, so poll is up first, and read this question, know what you are answering, and then we will have the video played for you multiple times. Okay, very good. Everyone feeling confident? I will give you 10 more seconds to answer this. Okay, a patient presents to a clinic with chief complaints of left hip and left lower back pain. The patient presents with an altered gait pattern. Which of the following gait pattern deviation is most likely seen in this patient, leading the therapist to recommend the following stretch as an intervention? Ooh, fun. I know, I can see the poll. Some of you are doing really good. So what is happening? What is the patient doing? They have an altered gait pattern. They have complaints of left hip pain, and we are doing the gait analysis. And then we are also finding out that we gave them a following stretch as an intervention. What are they trying to stretch here? They're stretching the hip flexors. Got it. Got that part. So let's now think about what will happen when they have tight hip flexors. They're going to read, we'll read the question options here. So excessive hip flexion during the right mid-stance to pre-swing phase. That looks pretty good, right? If I have a hip flexion contracture, is it going to tell me to go into hip extension or hip flexion? It's going to want me to go into hip flexion. So you matched it. You basically said, if you have hip flexion issues, you're going to have excessive hip flexion during the right mid stance, and that is going to be the correct answer. What will happen with option B, pelvis hike? That will be when you have hip flexor weakness. What will happen? Option D, circumduction, pretty similar, weakness. So option A is for tight hip flexors. And option B is for weak hip flexors. Option C is also for weak hip flexors. Option D is also for weak hip flexors. And option C in the middle I left is for weak hip abductors. Again, we will cover this again and again in our GATE classes. We have a full 1 week of GATE review, which comes in the middle of the cohort. We'll do normal GATE, abnormal GATE, prosthetics, orthotics GATE, and it should have all the information you need. But I just want to give you an example. If you're like, what are the video questions going to look like? So instead of saying the patient has tight hip flexors, they're showing you a video when they are showing you stretch for the hip flexor. So again, from our side, it is good news because then you're not guessing. You're actually able to see what the patient would do. And that is why the correct answer is going to be option A. Some of you are feeling a little nervous, which is totally obvious. And again, this question is not to create the fear and anxiety about, oh, I don't know what will happen on GATE. I just want to give you an example that this would be an example of a video question. So don't think too much about if I got it right or wrong. We'll have a lot of time to address that. We just will get the question correct first as a sequence or a flow or a style of a question. And then we have a lot of time left to answer some of the technical details. So A is correct. The rationale is on the screen. I do see some of you getting a little worried about your results on if you got it right or not. So I will answer those. But also for the special class, we need a special person to help you motivate and be ready for this upcoming change. So David, whenever he's ready, he's going to come on screen and talk to you a little bit about what he thinks about this change and how to stay motivated. So I will look at the chat and see if there are any responses on why A was only correct. So B is weak hip flexors, D is weak hip flexors, C is weak hip abductors or gluteus medius, and A is the correct answer. So David, all yours. We'll stop share the screen so you can have your full audience and go for it.
Thank you, Dr. Singh. And thank you, everyone, for joining us here today to discuss that 2024 NPTE. I know it's so difficult to step into an examination of the unknown, something different, a change, just like everything in life, right? When you have something and you just don't know what to really expect. Well, that's why we are laying it out for you in this class. That's why we are giving you that basis. That's why you can go into the 2024 and know what to expect. And we are going to further know what to expect within the classes. We're going to have updates galore. And we are going to remain side by side as we fight, as we train, as we take a step by step towards your dream. And you are going to do this. You just have to stay positive. Don't be scared of the changes, as all of you are finding out right here, right now. The changes are actually awesome. I mean, look at all of you in the chat room. How many people in the chat or listening at home right now are actually getting a little bit excited of these changes? It's pretty much like you're actually in a classroom right now. It's actually like you're in the clinic. It's actually like you have that patient right in front of you, and all you have to do is treat them as that PT, as that PTA that you know that you are meant to be, that you dream to become. And this is your moment to shine bright. And you are going to do exactly that. So do not lose hope. Do not be scared. Do not be nervous or anxious or stressed out. And if you do, you're totally normal. and understandable. But we are going to get through this together. So what I want all of you to do in that chat right now is to let out your final Frontier Warrior battle cry. I will pass. I will pass. I will pass. I will pass. I
You
will pass. I
You
will pass. I
You
will pass. I will pass. Prim, you gotta get the, come on. I will pass. I will pass. I will pass. Yeah. You will pass. So keep on going after your dream. Don't be scared. And if you are, please know that you can always contact anyone on the team. We are here for you. You are powerful. You are strong. You are a final frontier warrior. You will pass 2024. You are going to make your dream a reality. No doubts about it. That being said, I'm sending it on over to Dr. Singh. Let's go get it, Warriors. Yeah!
Thank you, David. Thank you, everyone, for all the positivity. I love the profession. I think it is a testament that you are here on a Saturday, worried about what's coming on the NPTE, and you are still staying positive and still chanting, I will pass. We are very appreciative of that positivity, and hopefully that will convert to a passing score on the exam. Thank you, David, for motivating us. And thank you, everyone, for contributing and drawing all those hearts and fun things in the chat. So we did cover question number 4. That was a video question. Hopefully, people are feeling a little bit better about their scenario-based, but we want to talk a little bit more about the content changes before we wrap up. The content, I'll do one question on a new content, and then we'll have a lot of time to answer any of your questions or doubts regarding the whole change, or when do the course starts and classes and all that good information at the end. Okay. Take a deep breath. You're all excited. Did anyone notice that Priyam was not wearing earrings? No, no one did. She was like, I don't want to come to camera. I don't have a Final Frontier shirt. I don't have my earrings on. Like, so if you meet her in person, tell her she looked cute and great and awesome, and we love to have her on camera. If you're wondering why is she here, we do not live in the same city. We live different coasts, actually, and Priyam is traveling with about how many? 9?
7, 8, yeah.
9 troublemakers. I call them troublemakers. So the Final Frontier team, just like you guys, needs a break after they take a big exam. So the NPT happened on Wednesday and Thursday, and we put them on a flight on a Friday night after they finish their clinical work, and they're hanging out. I don't know how my wife feels about it yet. I'll find out on Monday, but they're hanging out at my house, and they are all celebrating the end of a great cohort, and they are awesome as a family of Final Frontier graduates and team members who are in the same mission. I won't send a lot of pictures on what they do. I'll send one with kids. When they are with the kids looking cute in the backyard, I'll send that one, but I think most of that. Okay, so before we go too far and get too excited about this upcoming changes, we have to be smart. The worst thing that could happen is you do not know where the change was coming from. Okay, questions were decreased, clinical scenario was put in, but what else? What else changed? So here is our homework. This the credit goes to our team, especially our social media team, Kiran and Sarah, for putting this together. I was like, I want a 1-page graphic of what's changing. So here it is. Both of them are PTs. They're licensed and they love doing social media stuff and graphics as a part-time thing. So here it is. 2024, what are the overall gists of changes coming? So we're going to see more cardio and more neuro. Great news. We're going to see less of modalities. Oh, Megan, haven't we waited for this day? So less modalities are going to be on the exam. We were able to get rid of some of them, not all of them. So I will still teach you ultrasound. I'll still do some of the modalities, but we got rid of like phonophoresis. So there are new topics, gross motor development, a little bit more focus on that. Very, very excited to see telehealth. That is going to be a big sequence for the next few years of PT. And we have some topics on regenerative medicine and then electrodiagnostic results. Phonophoresis is out. So I know you're sad about it. I'm not. NDT is out. I know it has been out for PT curriculums for years, but used to show up on the exam. Taping for lymphedema is out because that was also a little bit outdated. So we will cover all of this. We have known this for a long, long time, but we want to officially inform you that we do have changes made in our curriculum already, and the number of questions are going to be lower because of going from 250 to 225. And for PTA friends, we have a similar graphic for you. We have increase in cardio, increase in equipment, decrease in modalities, gross motor development, phonophoresis has been removed, iontophoresis, some of those questions are removed, and then the same taping for neuro, compression, positioning for vestibular dysfunction, participation in professional organization. Some of those things have been removed out. Again, I do not want you to be nervous about this. Really think about what David was saying. Like he was saying, you will pass, right? And he was saying that for a reason, because we believe that you will pass. And I want you to look at the in-depth background work we have already done to assure that we make you prepared for this content change. So I'm going to introduce to you a new question, which we just created when they said that they will have electrodiagnostic tests. And just like every professor or instructor would say, whenever you create a new question, it might be a really good one. It might be a really bad one. I don't know, because I haven't tried it on anyone else except my own team members. We had 41 people take this question. Most of them said it was good. So it's on your screen, but now I have a sample of almost 300 people answering it. So please answer it and see if you can get the correct answer. This is the last question of the day. We promise that we'll be done in about 1 hour, 15 minutes, ending with 1 hour, 30 minutes with questions. So this is the last content question. Again, don't worry if you get it wrong. Just have the assurity that we know that this is now on the exam, and we have prepared a practice question and some content for it in the upcoming classes. So good luck, and let's see how many of you get it. Okay, good job, everyone. I'm happy to answer any questions at the end of the class here or now. We have a few questions which are coming up in the chat. I will answer them after we cover this one. Okay, 28-year-old software engineer reports a pain, numbness, tingling sensation in her wrist and hand. The PT suspects a median nerve injury due to positive Fallon's test. What is positive Fallon's test? What are we testing here? Median nerve? Good. Carpal tunnel? Perfect. The physician referred the patient out for a nerve conduction and CV study. Which of the following is most expected finding on the test? Your options are increased nerve conduction velocity. That wouldn't happen, would it? So nerve conduction velocity is basically when you are counting the speed of your nerve conduction. So I felt something in my hand and I got a signal from the back of my neck from that nerve root saying, let's go, see what happened. How fast this travels, nerve conduction is called nerve conduction velocity. It's usually pretty fast. I don't think our nerves like do a little dance to reach their milliseconds, right? So the time it takes for the electrical impulse to travel to the site which is stimulated is going to be, the velocity is going to be nerve conduction velocity, and latency is going to be how much time we're looking at, okay? So if my nerve conduction velocity decreases, that means I'm going to be late, right? So I'll repeat again. If my nerve conduction velocity is slower, I will be more late. So that means increased latency. So let's look at the options. Option A said increased nerve conduction velocity. So that should be decreased. If that is decreased, then I will be more late. So I will have option C as my correct answer because it's saying increased latency, and it is obviously not normal conduction, not increased, it's decreased nerve conduction velocity, and that is going to be C as correct. The slower you are, the more late you are to that event. If you have to go to an event, if you're slow in getting ready, like David, he has to do makeup and his hair has to look right. He has to wear, right? So then he'd be late. But he's not late, and that's good. Yeah, and needs perfect lighting. He needs a background. When you see him, he's usually wearing a black t-shirt, and then when he say, David, come on screen, he runs, puts on a Final Frontier polo and sits like this. So all of that is conduction, right? I said David on the screen, and David says, got it, and he runs and is on the screen. If it's slow, then we have latency, which means delay. And then I start making up stories of like, feel free to reach out to us. We're available by email and visit our website, because I'm like, come on, where are you? Like, how long does it take to put on a polo? Come on. Okay. Well, I've been told it takes longer to put earrings on. Okay, fine, we know it. I did not tell Priyam that she was going to be on camera. She did not wear a Final Frontier t-shirt. She does not have earrings on her. I promise I will go home. I obviously own Final Frontier. We have hundreds of t-shirts of different sizes. I'll make her wear one. We will have earrings on her, and she will post a picture. Good?
Good.
Okay. So C is correct. We are done with our content, and we have few things which I think are going to be helpful for you, but don't think of this as testing content. This is an example content of what will look like. So you're going to help me now, work with me, and make sure you are paying attention, because you have to tell this to your classmates and your professors. You have to deliver this information to your university. You are graduating in May. Some of them are not thinking about this. They don't know the exam has changed. So I am going to answer questions first for the profession, which is you, and then I will answer questions on NPTE Final Frontier. One question is, are the NPTE Final Frontier exams updated? Any guesses? If we could make 100 scenario questions, I can promise you the exams were updated. We just did not want to do what FSBPT did. They launched the PEAT exam, the new PEAT exam, in the middle of your October cohort. We did not want to do that. So they did October 11th. October 11th was when PEAT shifted. The old was gone and the new one came. We will do it right when you're ready for your first practice exam so that you don't have to lose your old exams. And we also don't want you to have to rush for this new change if you're taking the October exam. So what are the updates? Ready? 225 questions will come on the exam. How many will be graded? I have bad memory, you tell me. I had good memory, I told Prem to bring a t-shirt, right? 180 will be counted. How many questions per section? 45 questions per section. Okay, so 180 questions will be correct, and the passing score will be, we're estimating it in a range of about 121 to 128 out of 180, and that is going to be your passing score. Why is this range? Because if you take an academic PEAT, which is the PEAT which your school bought for you, one of them will have 121 as a passing score, the other one has 127 as a passing score. If you bought the regular PEAT, which non-DPTs can buy, or DPTs can buy too, but it's not, academic PEAT is not available for non-DPT students. So your passing range is in the middle there somewhere, 122, 126. So that's my range we are looking at. Same thing has happened for the PTA. You used to have 150 questions graded. Now we'll have 180 questions, 140 will be graded, and the passing score is going to be also pretty similar to the percentage of the PT. So don't confuse too many numbers. But the key part for both of them is the scaled score will be 600 out of 800, and we're expecting about 67% of questions to be correct to get that passing score. Will the Final Frontier exams be available for anyone who has already purchased them as a student who took the October exam? Yes, your course pages will be updated and you'll be able to see new readings. There are not a lot of changes in the course syllabi, right? We haven't changed new content. We just decreased the number of questions and added case scenarios. So for Final Frontier exams, the passing score will be 600 out of 800, and it will be in this range of 124 to 125 out of 180, and you will be able to access them the same way you used to access them if you're a previous student. A lot of you are joining us new, so I would highly recommend you to join our introduction class, where we will break it down everything on November 11th, November 9th at 5 p.m. PST. We do have an introduction class for every cohort that sets the stage. That will be the first class of this new 2024 January cohort, and that will be our way to describe what Final Frontier has done. This class was professions first, and trying to educate you, your friends, your professors, anyone who's interested in listening to you, that the NPTE is changing and changing for the good of the clinical world. Okay, if there are questions on what we have covered, I would highly recommend you to stay here and ask questions on the upcoming changes, on the content we covered. If you want me to explain something again, for those who are going to be joining us for our 2024 January cohort, we look forward to working with you. Oh no, wait, sorry. David, delete that part. We have limited spots. We cannot fit more than these many people. We want you to join today and now, and that won't look good, right? I can't have a class on professions first and then tell you that we have limited spots. We have a lot of spots for you. I want you to feel prepared. The only thing that's going to change if we get a bigger enrollment is we will have more co-hosts and more tutors to help you, because we don't want you to feel just a number. We know you by name and we will know you by your score. And I will see, we want you to be able to pass the exam. Okay. Revision time. Should I be worried about the new exam? No. Will the exam be more difficult? No. Is the exam duration going to be the same? Yes and no, right? It is still 5 hours. That is something which we have heard a lot. It is still 5 hours total, but the exam is going to have less number of questions in the same time. And we concluded today that that's good for us, because I would want you to think clinically, answer quickly, but you're getting more time. So that will be there. How many questions for PT? 180. PTA is 140. Is the syllabus changing? A little bit in a good direction. We're getting rid of some of the older things like NDT. How will I prepare for it? You can prepare for it by yourself. You can be part of the NPTE Final Frontier family. There's a distinction. You can be part of the NPTE Final Frontier family because we have, for example, a Facebook group with 30,000 members. We have an Instagram group, which is the biggest following. We have a podcast, which has 500,000 downloads. David and Emily run it. We have a Telegram page. We have a lot of things where we keep updating you, including, most importantly, our website. So you are welcome to be part of the Final Frontier family and consume this free information, or you could be part of the family every week and hang out with us and attend classes. And will practice exam have changes? Yes. The PEAT change, I cannot speak respecting copyright on what changes happened, but I can tell you no one has the time to change the whole 250 question exam. So changes happened, but happened based on the scenario questions. So you will see a similar content being covered in this new exams. And the same thing will happen with Final Frontier. We'll have a lot of content for you, a lot of pictures, a lot of videos, a lot of case scenarios. And I'm sure that will be more than enough for you to pass. And if you're wondering who are these people who are in the chat using their name as NPTFF, there they are in person, and I can count all of them for you and put their names next to them. But I think that proves that we are unified here to help you pass this exam. The biggest thing I'm seeing here is, will I lose my old recordings? No, you won't lose anything. We're just adding things to keep up with the changing environment. And I look forward to seeing all of you in person sometime. And I will quickly count. David makes fun of me if I start drawing circles. I used to do this where I'm like, okay, this is David Friedberg. He said, don't do that. So in this picture, you have me, which is pretty easy to recognize, I hope, with my turban and my height. And then we have David, who was here. Priyam came to the screen for a minute. Megan Duncan is sitting next to her, and they are an awesome team. We have a couple of other people who are going to be joining us in this picture soon. They did miss the group picture here in San Diego because they live on the other coast. Amanda is going to be joining us in Boston this coming February. And then you have some of your co-hosts who have been with us for a long time, Rekha, Siddhi, and Pamela. They are going to be helping out in the chat for these cohorts. Other people we have on the screen are probably going to be seen on class 2. Next to David is Brunda, who's our neuro instructor, helping Kristen, and then Derek Camilleri is in the back, and Kiran is the social media chair on the other side of the screen. I know, these are actual people and not outsourced out of a country and just typing in the chat as bots. And we do use a lot of AI, but not when it comes to education for NPT. All right. Any questions if you have, please let us know anytime now. And I have included our content, our introductions, our orientation, and I hope to see you all in class for our introduction class on 11/09 at 5 p.m. PST, and we'll see you there. What else can I answer, David? Okay, there's some people who are not on that picture. Mike is not on there. We have pictures of him separate in New York. And let's see. You are not a bot, that's correct. Okay, just repeat. Things are changing for the good. Stay strong, stay powerful. Believe in the future of the profession. Join us for the upcoming class on that 5 p.m. weekday class. And then if you're going to join us for our regular classes, they will be Tuesdays, Thursdays, 5 p.m. and Saturdays, 8:30, just like today. We can allow you to unmute if you have questions or doubts. We can try to address any of the content, but I know it is going to be important for you to take time, spend time with your families, and we don't want to keep you here for long. So have a great weekend from my side. I will stop the recording so that you can